So the idea behind block scheduling is we place appointments and people in a certain order instead of just filling the schedule in, okay? So I did an overview for you guys here. If you guys kind of see the difference between just throwing the schedule together is when you throw the schedule together, it's like one of those days where there's 42 patients and we see them in their 20-minute appointments and everyone's running around and patients are mad and they get sat mad and they wait and the assistants are, they skip lunch, and at the end of the day we've done like $1,000 of dentistry. That's not what we want to do. What we want to do, the ideal day or productive schedule, is actually seeing fewer patients. A large amount of treatment is done for one patient. So we try to do what's called quadrant dentistry. So, and you've seen this, where they'll do like 2 teeth at one time or 3 teeth versus one appointment, for one filling and then come back for another filling. Because every time we do that, we have to reset the room. We have to re-get the patient now, and it's not very productive. So we do more dentistry in one appointment. Appointments start and end on time. So when you're not squeezing people in and rushing around, you're actually getting people in on time. We have enough time to work with them. We're getting them out on time. So that way patients are happier. And then the atmosphere is just more controlled, more relaxed. Those days where we see 1 or 2 patients and everybody gets sat on time, that's a productive, good day versus those days where it's hectic and crazy. And then, of course, we reach our goals. So we always have to start with a goal in mind. We can't just throw people in the schedule. We want to say, okay, well, what's our daily goal? And then how are we going to build the schedule accordingly?